Veterans are twice as likely to become chronically homeless as other Americans. About 11% of homeless men and women in the United States are veterans. To put it another way, on any given night, about 48,000 veterans are homeless. With more than 400,000 veterans living in New Jersey, the New Jersey Hospital Association is trying to reach these vets. Studies show the best way to do that is with veterans helping veterans groups. Using government and private grants of more than $3 million, the NJHA has hired healthcare navigator specialists who connect vets with services. That means going to where the need is. Places like Joseph's House in Camden, a drop-in center for the homeless. So far, the NJHA has assisted 70 veterans get medical and mental health care, as well as assistance with finding housing, employment, and veteran benefits. The outreach programs are run from NJHA's headquarters near Princeton. Jennifer Shreefy, Director of Community Programs for the NJHA, explains how that works.
A number of these programs are in the beginning stages, but we did have an enrollment program where we first utilized veterans as part of the certified enrollment counselors that supported that enrollment in the community. And they were able to assist well over 5,000 families with enrollment and contact over 20,000 families just to share information and support their general health care needs.
Eileen Holmes, NJHA's Senior Vice President of Clinical Affairs, holds a doctorate degree in nursing. She also has a unique perspective of veterans' issues. Dr. Holmes is a Navy Nurse Corps veteran. She served stateside in a naval hospital in Pensacola, Florida. When it comes to problems that top the list for returning vets, Dr. Holmes has really been there.
I have PTSD every once in a while. Helicopters. I mean, because one of the hospitals where they would bring with the Marines, if you were hit in Vietnam, they would take you to the ship, and then the ship would, you come home, and so we had these, really big helicopters that would come with all these, guys who had been, shot or blown up in Vietnam, and it's a very distinctive sound of those particular kind of helicopters. And so I've worked in a lot of trauma centers since I got out of the service, and they all have that same engine noise. And so when they're coming in, a couple of times I felt my heart racing for it, just in anticipation. I remember the guys who were had been blown up there and coming back, and then they would start having flashbacks, and I spent many nights under beds with guys who were just thought they were back in Vietnam getting blown up. So it was a lot of memories for that. So even though I wasn't, as a nurse I wasn't exposed to it, but I saw a lot of it.
Fortunately, military medicine has learned much about PTSD and also traumatic brain injury since Dr. Holmes' time in that hospital.
We have learned a lot in the military. The veterans and the military hospitals have learned a whole lot about PTSD, and I think, and TBI, and being able to diagnose it much earlier and getting individuals into care much earlier, and realizing and educating the public that this is not, this is not something that they did. They're not. This is part of their experiences, and they need to deal with it because it is going to come back and in various ways and hurt them or haunt them later. So I think it's early recognition, but just getting rid of the stigma and recognizing that we need to help them and that this is real for them.
Veterans returning home from conflicts in the Middle East often have different needs from those of veterans of earlier wars. Their medical needs may be similar, but their psychosocial needs can be very different.
We have veterans from Iraq, the 2 Iraq wars and Afghanistan, and they will talk about the difference. That you can't, that they all have different experiences, and they all took away from their experiences in those countries. They're all different, and so you can't expect somebody who comes back from Afghanistan to necessarily understand what happened to some of their colleagues in Iraq. So they have different experiences.
Psychological problems are bringing more people in general, not just vets, to emergency rooms. Dr. Holmes says that includes substance abuse.
I've been a nurse for like 7 years. That was always something you kind of hid. You didn't think about it as being, people were just thought to be crazy and you didn't really do it. But now we know that there's a lot of really good reasons why they have these problems, and there's a lot of good things we can do to help people with that and get them back in control of their lives.
Women vets are also undiagnosed, she says.
We're starting to see some of those stories come out now. I think how women, in the service have been treated up till now. I think there's a growing sense that we need to create safer environments for, and be aware of the potential dangers that they're going to be into, not just from the enemies or whatever, but also just from within it. Military medicine is pretty much of a culture that has been very, very male dominated, so it's going to take some understanding and work to get it to change a little bit.
Dr. Holmes says programs in New Jersey are having a positive effect, but as a whole, veterans care has a ways to go.
We know from all the headlines, and I have not been involved in any of it, but there's been access issues and waiting times. And so, the VA system for so many years was the epitome of patient safety and quality of care, and they were the first ones out of the gate with electronic health records, and they have some really, really, really talented people, and I don't know whether just need some more organization or systems, but we have to do a whole lot better job, I think, because we're putting a lot of young individuals in this country at risk for all kinds of complications if we aren't able to identify and help them early on. We've learned so much just from traumatic wounds. People who lost their legs in Vietnam often died when they were blown up. Here, there's been so much work done in prosthetics since Afghanistan, and now you see so many people now, and it's becoming more acceptable, and there's not nearly the stigma. So we just need a lot more work to be done.
The headquarters of the NJHA, just outside Princeton, is about a 40-minute drive from Camden, but in terms of demographics, it is another world. This is where the boots hit the ground, and the real work of helping these vets begins. Jay Silver is a mental health care navigator and certified application counselor. He holds a doctorate in psychology.
First up, we try to do is decrease repeat visits to the ER by engaging in intervention. We try to assess cognitive issues where we have veterans that may be going to the ER as a hand-holding ceremony for a number of reasons. Post-traumatic stress disorder could be one. It could be some type of cognitive deficiency, touches of Alzheimer's, dementia, touches of being autistic. Our job is to get them to the right agency versus using the ER as a platform to engage, and that way we can cut down the bottom line.
Dr. Silver also counsels people who are not veterans. He is an Air Force veteran who served 2 tours in Alaska and also served elsewhere in a covert operations role he says he cannot discuss.
You hear so many folks say, listen, thank you for your service. You served in the military, but until New Jersey Hospital Association came along, it was the first organization that really said, hey, listen, we really appreciate you as a veteran for what you did, and offered myself as well as other veterans a job. And it's one thing to say, hey, listen, thanks for what you did. And then there's a whole nother issue for me to grab you and take you down to Starbucks and buy you a fat piece of Danish and a cup of coffee. And I put a smile on your face. So NJHA have done that for myself and so many other veterans. So they actually put their money where their mouth was. Veterans are the same as anybody else. The initiative is that because veterans have been perceived to have given so much, and folks feel as though that as a community, they have not given back. The need is great everywhere, just not in Camden. It's an intense effort. It's not going to change overnight, but we are making gains.
Communication and follow-through are the biggest challenge, Silver says.
And then 2, establishing a line of trust. Your word has to be a bond. You have to adhere to that, and then you can make just about anything happen.
Veterans can be particularly reluctant to seek care.
Absolutely, and like with anybody else, after you've been told for so long change is going to take place, and you don't see any change, then you're reluctant to give your trust.
Few will argue with the need to help veterans, but that costs money. Silver says the state is focused on reducing emergency room costs.
When individuals go to the ER and they have no insurance, the state has to pick that up. So what we're looking to do, if we can reduce that cost to the state, that's a trickle effect. We looked at where that money can be applied to other programs that are more needed. For one being housing. We have to understand first is that you have to take care of basic needs. Sure, it's a good thing getting somebody to work, getting somebody back on their medications if they have hypertension, diabetes, if they need cancer treatment or pre-screening treatment based on a predisposition. All that's well, but if an individual doesn't have the basic needs of shelter and food, all that becomes secondary. So it's a collaborative effort where we can show correlations and bring all that together under one roof.
But there can be setbacks.
For example, last year, the Battleship down in Philadelphia had a massive campaign to bring veterans on board, to feed them, to pass the information, to get them on board. From that initiative, we only had about maybe 3 or 4 show up. We supplied transportation, meals, a buffet, the whole 9 yards. And it was kind of disheartening on one side. So once again, it comes down to that line of communication. Once we bring all that in play, we all have the same vision, we're all mobilizing with the same effort, then we're going to see some great things take place.
A major issue for some returning vets is finding housing. NJHA veteran healthcare navigator Michael Mims, who holds a doctorate degree in education, says that goes hand in hand with finding work.
The great thing is there's a lot of jobs that are available in all various different disciplines, and the fact that they're veterans gives them kind of a leg up in terms of a preference on what it is that they can do. You'd be surprised, even a lot of people in this homeless shelter, just because they're homeless, they ran into some bad times, still doesn't mean that they're not skilled, they're not qualified, and they don't have the necessary requisite skills to do any job.
Dr. Mims says he's had some surprises in counseling vets.
I spoke to one gentleman, he was a carpenter out of work, okay, and carpenters, good carpenters, aren't readily available, so that was something we were trying to find him. People are the truck drivers because they drove trucks in the military, and if you could drive a 10-ton or a 5-ton truck in the military, something like this is nothing for them to do. But you have to go through the process of getting them their licensing, getting them to pass the test again, getting recertification, and those are some of the things, along with a lot of the other things that we're going to be doing for the veterans, that we can look in or send them or put them in the correct direction in order to help them achieve those certifications and licenses as needed, in addition to the health care.
A Marine Corps veteran who served in Germany, Dr. Mims says his leadership skills have been valuable in this new challenge.
That leadership as leading Marines brings you a whole new skill set of how to deal with people, how to work with people across all the spectrum of races, colors, creeds, cultures, whole 9 yards. It's been more than helpful. My hopes for the coming years is to get some stability in terms of where we go. We want to see those kind of people that are saying, hey, we know you're here, you can help us, let's get busy.
But in some ways, helping veterans today may be easier than in earlier eras. At least, he said, veterans from the 1980s on, like himself, got a good reception.
It was welcoming, not like the actual Vietnam era, because I finished up in 81, 82, and not like the Vietnam era where it was a little different with all the politics going on. When I came back, it was receptive, but not like now. Now, if you even spit the words, I'm a veteran, they're like, yes, thank you for your service, I appreciate it. Where'd you serve? Semper Fi, Ora, the patriotism now in our country is unparalleled in my estimate. And one last thing, New Jersey Hospital Association, and Jay alluded to it, I've only worked in 2 organizations that were even close. The first one was the United States Marine Corps, which is unparalleled to me. The New Jersey Hospital Association out of Princeton is unparalleled in the way they treat people and take care of their employees and just always are caring. Even for business, it's uncanny how well they've taken care of us as veterans and people that aren't vets in the organization. Just want to give them a shout out. They've been tremendous.
The NJHA outreach experiment will continue through 2018.